My name's Amy, I'm the Patient Engagement Officer at the Cheshire and Merseyside Cancer Alliance. Before we decided what we wanted our projects to look like, we wanted to hear from the local population for their thoughts on NHS administration. So that's what we done. We hosted a feedback event in November where we had a room full of patients and carers as well as local staff and trusts. And it was a brilliant day. We had lots of great discussions about what works well, what doesn't work so well, areas to be improved, and it really gave us this start point of this is what the local population wants.
Hi, I'm Louise. I've had cancer and I've also cared for my parents who had cancer. So I wanted to come today just to see if I could help improve any of the admin situation that I went through myself. So I found some of the letters quite overwhelming. If things could just be compacted down to maybe one booklet, I'd find that helped me, as well as maybe just offer some counselling services to, as well as not just yourself but your loved ones as well.
Collaborating with others and bringing together staff, patients and carers in Cheshire and Merseyside has resulted in the confidence that services really can be aligned to what matters most to patients and their families, and has really helped to tackle health inequalities faced by many members of the public in the region. Getting involved in the Cancer Experience of Care Improvement Collaborative, led by NHS England and part of the Experience of Care programme, has been extremely beneficial to help improve admin and communication services for cancer patients in the region.
Working on this kit has been a privilege. Collaborating with external colleagues towards the same aim has been a highlight of my career, personally and professionally. I feel it's been so beneficial. It's also been instrumental in the development of my day-to-day job at University Hospitals of Liverpool. We're hosting a Macmillan-funded project to co-produce a gold standard model of cancer information and support delivery. It's shown the importance of listening to that patient experience. We've worked with community stakeholders and partners and are now delivering 4 pilot community cancer information and support hubs across South Sefton, Knowsley and Liverpool.
As a patient's representative, I found that it helps me to share my personal experience and the experience of others I have spoken to when discussing the work undertaken in some of the projects. I have my own personal bugbear, for want of a better word, in that I'm called by my middle name. And despite this being on systems that it is often overlooked and needs correcting, that I'm actually called by my middle name. But for me, this shows that the person-centred side of any project needs to be remembered, and that any interview, questionnaire or other means of communication needs to be in a way that is dignified, accessible and inclusive to any respondent.
As a younger and new member of staff, the Cancer Experience of Care Improvement Collaborative has been a great learning curve for me, as I have had opportunities to get involved in project management, learn about quality improvement and benefit from the collaborative approach.
Being part of the KIC project team is so beneficial, and being involved in putting forward the idea of the About Me form to improve patients' experience during such a difficult time is so much more than rewarding. If I can help improve just one person's journey, then I am more than happy. I'm so proud to say I'm part of it.
Thank you for watching, and I would highly recommend getting involved in future Cancer Experience of Care Improvement Collaboratives. My top tips would be: allow yourself plenty of time to deliver your project and really get out there and speak to those who wouldn't usually come forward to engage.